Welcome to our YouTube channel Medical Subjects Made Easy. Today's topic is postnatal care. 1. What is postnatal management? Postnatal management refers to the health care and support provided to mothers and their newborns after childbirth. 2. What are the key goals of postnatal management? The key goals of postnatal management are to ensure the well-being of the mother and newborn, promote bonding and breastfeeding, monitor for any complications or health issues, and provide education and guidance to the mother. 3. What are some common postnatal complications that mothers may experience? Some common postnatal complications include postpartum hemorrhage, infection, perineal pain or tears, breastfeeding difficulties, and postpartum depression. 4. How is postpartum hemorrhage managed? Postpartum hemorrhage, which refers to excessive bleeding after childbirth, is managed through the administration of medications like oxytocin, manual compression of the uterus, and, if necessary, surgical interventions. 5. What are some potential signs of postpartum infection? Signs of postpartum infection include fever, foul-smelling discharge, pain or redness around the incision site or perineum, and general malaise. 6. How can healthcare providers prevent postpartum infections? Healthcare providers can prevent postpartum infections by ensuring proper hygiene during delivery, providing antibiotic prophylaxis when needed, and educating mothers about wound care and hygiene practices. 7. What are the recommended measures for perineal pain management? Perineal pain after childbirth can be managed through the use of pain medications, regular ice packs or cold compresses, using a peri bottle or warm water for perineal hygiene, and avoiding activities that strain the perineal area. 8. What are some common breastfeeding difficulties that new mothers face? Common breastfeeding difficulties include engorgement, cracked or sore nipples, low milk supply, and difficulties with latching. 9. How can healthcare providers support mothers with breastfeeding? Healthcare providers can support breastfeeding mothers by providing education and guidance on proper latch techniques, offering assistance with addressing any breastfeeding difficulties, and referring to lactation consultants if necessary. 10. What is postpartum depression? Postpartum depression is a form of depression that affects some women after giving birth. It is characterized by feelings of sadness, anxiety, and exhaustion that can interfere with daily functioning. 11. How can postpartum depression be managed? Postpartum depression can be managed through a combination of therapy, support groups, and medication if necessary. It is important to seek help from healthcare professionals if experiencing symptoms. 12. What are some warning signs of postpartum complications in newborns? Warning signs of postpartum complications in newborns include difficulty breathing, poor feeding or low appetite, jaundice, fever, and unusual lethargy or irritability. 13. How often should a newborn be examined during postnatal care? Newborns should be examined by a healthcare provider within the first 24 to 48 hours after birth, and then regularly at scheduled intervals, typically at 1 week, 2 weeks, and 1 month of age. 14. What vaccinations are recommended for newborns during postnatal care? Common vaccinations recommended for newborns include ones for hepatitis B, diphtheria, tetanus, pertussis, polio, rotavirus, and pneumococcal infections. 15. What is the purpose of the APGAR score in postnatal care? The APGAR score is a quick assessment tool used to evaluate a newborn's physical health and make initial observations about their well-being. It assesses heart rate, respiration, muscle tone, reflexes, and color. 16. How often should postnatal visits occur for mothers? Postnatal visits for mothers should typically occur within the first week after delivery, followed by a visit at 6 weeks postpartum. However, the frequency may vary based on individual needs and any complications experienced. 17. What is the role of postnatal care in promoting maternal mental health? Postnatal care plays a vital role in promoting maternal mental health by providing emotional support, identifying and addressing signs of postpartum depression or anxiety, and connecting mothers to appropriate resources or therapies. 18. How can breastfeeding be supported during postnatal care? Breastfeeding support during postnatal care can be provided through counseling on latching techniques, addressing breastfeeding difficulties, educating on the benefits of breastfeeding, and promoting a supportive environment. 19. What can mothers do to ensure successful postnatal recovery? Mothers can ensure successful postnatal recovery by following healthcare provider recommendations, practicing good self-care, getting adequate rest, eating a healthy diet, and seeking support from their loved ones. 20. How long does postnatal bleeding typically last? Postnatal bleeding, also known as lochia, typically lasts for around 4 to 6 weeks postpartum, gradually decreasing in flow and changing color. 21. What are some self-care practices to promote postnatal wellness? Self-care practices to promote postnatal wellness include getting enough sleep and rest, eating nutritious meals, staying hydrated, practicing relaxation techniques, and engaging in gentle exercise as approved by a healthcare provider. 22. What factors should be considered when choosing a contraception method after childbirth? Factors to consider when choosing a contraception method after childbirth include the mother's breastfeeding status, overall health, personal preferences, effectiveness, side effects, and the potential for future pregnancies. 23. What are some pelvic floor exercises recommended for postnatal women? Pelvic floor exercises, such as Kegel exercises, can help strengthen the pelvic floor muscles after childbirth. These exercises involve contracting and relaxing the muscles involved in controlling urination. 24. How soon can sexual activity be resumed after childbirth? The timing for resuming sexual activity after childbirth varies for each woman depending on individual recovery and preferences. Healthcare providers generally recommend waiting until any perineal tears or wounds are healed, postnatal bleeding has stopped, and both partners feel emotionally ready. 25. What are the benefits of postnatal support groups for new mothers? Postnatal support groups provide a safe space for women to share their experiences, receive emotional support, exchange advice, and gain reassurance from other women who may be going through similar challenges. 26. What are some signs that breastfeeding is going well for both mother and baby? Signs that breastfeeding is going well include the baby having appropriate weight gain, good levels of wet and dirty diapers, showing signs of satisfaction after feeding, and the mother experiencing minimal pain and discomfort during nursing. 27. What are some signs that a newborn may be having difficulties with breastfeeding? Signs that a newborn may be having difficulties with breastfeeding include poor latch, frequent feedings lasting longer than an hour, lack of weight gain or inadequate diaper output, and signs of frustration or excessive crying during or after feeding. 28. How can postnatal education contribute to overall maternal and child health? Postnatal education can contribute to overall maternal and child health by providing mothers with knowledge on newborn care, breastfeeding, recognizing signs of complications, and promoting healthy practices that can enhance the well-being of both mother and child. 29. What role do partners and family members play in postnatal care? Partners and family members play a crucial role in postnatal care by providing emotional support, assisting with household tasks, caring for the newborn, and helping to alleviate the mother's workload, allowing her to focus on recovery and bonding with the baby. 30. When should a healthcare provider be contacted during the postnatal period? A healthcare provider should be contacted during the postnatal period if the mother experiences severe pain, excessive bleeding or clots, signs of infection, concerns about breastfeeding, persistent feelings of sadness or anxiety, or any other worrying symptoms or complications. If you found this